Hello, my name is Courtney Spees, and will be doing the peptic ulcer disease case study. So we have Mrs. Baker here. She came into the ED complaining of nausea and severe epigastric pain and she's had it for 3 days. So the first thing that I do when I walk in the room is just look how she's positioned herself, look how many side rails she has up, look if she has any IVs, tubes, drains, lines, anything like that. I would look and see if she would have oxygen on, and if she did have oxygen, I would note the rate of that, the flow, and then I'd also note what delivery method she's having, like a nasal cannula or a bipus, whatever. Anyways, then I would also check her surroundings, so making sure that she has no clutter to the bed or to her bathroom or to the exit, and then also making sure that she has her call light and then her side table within reach, and also making sure that her bed is also lowered. No falls today. Alright, so the first thing I'm going to do is ask you your name and date of birth. Okay, and then do you know where you are? Okay, can you tell me today's date and the time? Alright, and then I'm going to go ahead and check her ID bracelet. So she was drowsy but she was still oriented. So the next thing that we're going to do is just sit this right over here. So the first thing I'm going to ask you to do, miss, can you turn your head to the right, please? Okay, to the left. Okay. Her skin pallor is pale, but her skin feels kind of warm, and she's a little diaphoretic. Okay, I'm going to go ahead and ask you to push, pull, squeeze my hands, wiggle your fingers for me. Alright, I'm doing cap refill on both hands. Okay. Are you having any numbness, tingling in your arms? No? Okay. So the next thing that we're going to do is ask, have you had a cough recently? No? Okay. I'm just going to go ahead here and listen to you. Take a deep breath in every time my stethoscope touches your skin, okay? Alright, ma'am, can you scoot to the edge of the bed so you can go ahead and sit up, please? Alrighty. And can you do the same thing for me, please? Just take a deep breath in. Alright, can you raise this right arm for me, please? Thank you. Alright, and then raise that left arm for me as well. Okay. Can you get my back down for me now? Alright. So, next thing I'm going to do is ask, are you able to pass gas? Okay, and when was your last bowel movement? Alright, is your abdomen tender today? Who's up here? Okay. So I'm going to go ahead and I inspected her abdomen. Palpate. Alright, and then she noted that she had some tenderness on her right upper quadrant. Alright, I'm going to go ahead and listen to you if that's okay. So bowel sounds are present in all 4 quadrants, but they are hyperactive. Alright. Can you go ahead and wiggle your toes for me? Alrighty. Can you push? Can you pull? Alright, I'm going to go ahead and check cap refill. Are you having any pain while you're urinating? Any discharge, anything like that? Okay. Are you having any pain or any numbness, tingling in your lower extremities today? No? Okay. And the last thing I'm going to do is do perla, so neck. Also, no edema was noted in her upper or her lower extremities as well. And her chest was symmetrical with rising. Alright. So, what we're going to do today to kind of help with your nausea and vomiting is I'm going to go ahead and administer some Zofran for you. That helps with nausea and vomiting. I'm going to go ahead and put it right through your IV so I don't have to poke you. You'll probably start feeling the effects in about 15 to 30 minutes. And I'd like also for you to tell me if you have any sign or if you feel like you're agitated, if you're having any hallucinations, if you're dizzy, if you continue to really sweat a lot or anything like that, or if your gastrointestinal symptoms get worse. The reason why we're watching for this is I'm going to monitor for serotonin syndrome. And then a couple other side effects that would be just normal side effects would be if you have a headache, constipation, or diarrhea. So what I'm going to do is I'm going to go ahead and give this to you, and then you'll start feeling the effects of the medication in about 15 to 30 minutes. So before I give her this, I'm going to go ahead and assess her for her nausea, vomiting, abdominal distension, and bowel sounds prior to and then after I administer it, just to get that baseline. So I'm going to go ahead and show you how I'm going to prepare this. Hopefully you can see that. I think you can. Yeah. Alright, so the first thing I'm going to do is wash my hands. I explained the procedure to the patient. I went ahead and asked her name and date of birth, and then I checked her armband to go ahead and do some patient identifiers. I went ahead and asked her if she's ever had this medication before, and I did some patient teaching on the side effects and what to expect after she gets this drug. So I've already checked if her IV was patent, and it was. So I'm going to go ahead and wash my hands, and then I'm going to go ahead and put on gloves. Sorry for my voice, I'm sick. Okay, so the first thing that I'm going to do is go ahead and open everything that I need. So I'm going to open this syringe so I can flush her IV. And then I'm going to go ahead and open this. And I'm going to go ahead and open another one too, just specifically for her IV. Okie doke. So the first thing that I'm going to do is check the orders. And it looks like we are giving you six milligrams. Where the heck did that go? Oh, 4 milligrams through IV every 6 hours. So I'm going to go ahead and draw up 4. What is it? 2 milligrams. Let's see. Okay, and then I'm going to carefully remove the tip of the needle. So I have my air. I'm going to go ahead and inject. Oh, actually, take that back. I'm kidding. Just kidding. I'm going to wipe this off. LOL. Clean this really well with alcohol before I do anything. Let that dry completely. Then I'm going to inject air. Okay, so I'm going to inject that air to make it easier for me to draw up. And I'm going to draw up total amount of medication. Trying to ensure that I don't get too many air bubbles in this. Alright, I'm going to pull this out. Flick it to get the air out. And then I'm going to, for safety purposes, I'm just going to recap this needle since I have to turn around for my couch. Okay, so now I have my medication, I have my alcohol prep pad for the IV, and then I have my flush. So I'm going to go ahead and tilt you back up here. Okay, so I have my supplies. Let's just pretend this is a clean table. Okay. I'm just going to move this patient over here. Back, just over my couch. Alright, so what I'm going to do first is, like I said, I already checked the IV patency. I'm going to go ahead and clean off the port closest to the patient. So I'm going to clean this off. Put this down. Pop my flush. I'm going to clean my flush. Okay. So I'm going to go ahead and pop that on, and then I'm just going to flush half into the patient's IV. And then I'm going to make sure I put this somewhere clean. Okay. Then I'm going to uncap the needle. And then I'm going to wipe again the port. I'm going to inject the needle directly into the port. I would put the safety lock on this, but we're using this needle, so I'm just going to recap it. Clean the port one more time, and then flush once again. Flush the rest of the way. Alright, and then I'd cap the hub. So, I would document the correct date and time. I document how much of the medication I gave, when I gave it, how I gave it. So I gave it through IV push. I document how the patient tolerated it. I document what was running, what I flushed it with, how much I flushed it with. And then I'd also document her reaction. So I'm going to go ahead and do a handoff now. Oh, I'd also push this over at least 30 seconds, and preferably over 2 to 5 minutes. And then it's 2 milligrams per milliliter. So 2 milliliters I would have given. So Mrs. Baker came in to the ED complaining of nausea and severe epigastric pain. I did an assessment for her, and she had some tenderness over her right upper quadrant. She ended up vomiting 300 milliliters of coffee ground emesis, and then I called the doctor, and he gave me an order for 4 milligrams of Zopran every 6 hours through IV push. And then after that, she became weak and drowsy. She had a positive fecal occult stool, and her hemoglobin was a 10, and her hematocrit was 31. I inserted an NG tube to look at her stomach contents and decompress her stomach, and after that, I came back and she had half of a canister full of bright red blood. Her blood pressure had dropped to 96/60. And so I went ahead and called the doctor. They did a stat EGD, and then they found 2 slow bleeding gastric ulcers. They cauterized and one arterial bleed, and they repaired that as well. So I've just been monitoring for any post-op bleeding, her vital signs. I also hung 2 units of blood, so I'm just going to go ahead and continue to follow the orders for that. And then also just keeping her hydrated and making sure that her pressure stays up. So, yep, that is about it. Her vital signs were 98.6, her heart rate was 122, her pulse ox was 97, and her blood pressure was 96/60. So, that's about it.